9 minutes away from 7 on Metro Morning, minus 23, minus 32 with the wind chill up to about minus 15 under sunny skies today. A new study you've been hearing about points out that when it comes to seeing family doctors, Canadians wait longer to get an appointment than people in many other developed countries. That situation is not helped by the hundreds of foreign-trained doctors who arrive in Canada every year but have little hope of ever working again in their profession. Every year, though, some of those foreign-trained doctors are in fact turning that barrier into an opportunity to continue doing the work that they love, as Mary Weens discovered when she dropped in on a lecture at the Toronto School of Traditional Chinese Medicine.
Yeah, okay. We'll just finish that, okay? And that is when there's a wind cold there, what we do is that we're going to drink some ginger tea, okay? Now, what do you think Western medicine would do? Let's see in Amy's case.
If Amy went through the emergency room, she would be prescribed antibiotics depending on her condition. And for her digestive issues, she would probably be given anti-motility agents as
Maria
well.
Florentine is one of 6 foreign-trained doctors at this school. They will each spend 4 or 5 years at a cost of roughly $50,000 studying to become TCM doctors. This afternoon's lecture by Dr. Wu, the head of the school, is about the common cold.
What are these exterior pathogenic factors? The leading factor is wind. When these pathogens invade our body, the body's vital energy start to fight, right? We call them 正气. 正气 here. But 正气now, when we talk about it, what is the system? Amy, this is Dr. Amy from China. A cardiologist now is going to become doctor of TCM, right? So in Western medicine, what is almost like equivalent to our 正气 there? Which system?
The immune system. That's 正气means our right qi.
Amy Du was a cardiologist in China, but gave it up in search of better opportunities in Canada for her son. She planned at first to take the costly and lengthy exams required to certify as a doctor, but realized the odds against her were too great.
Yeah, I have, both of us, we have some friends, they write the exam, they pass out the exam, they cannot get the residency. I have a couple of friends, they spend 5-6 years, because at the beginning I also thought about it, studying to do the exam, to be a doctor here. And also I have a little kid at that moment. I cannot do all those efforts just to get nothing. We decided to give up.
My family and I migrated here 5 years ago, so we're fairly new here. So as a doctor in the Philippines, I worked there, was connected with a hospital.
Like Amy, Maria also emigrated for her children's sake. In Vancouver, she had a good job in a health clinic, doing blood work, diagnostic tests, and CT scans. But her growing interest in TCM was raising questions in her mind about modern Western medicine.
Practically speaking, when you see patients and they complain of certain signs and symptoms, it's very easy just to get a prescription pad and write, whatever medications they have to take. But it's just to address the signs and symptoms, but you're not actually healing or coming down to the root cause.
A familiar criticism, the over-reliance of Western medicine on pharmaceuticals. Chinese medicine, with its more holistic approach, has its own limitations. It has none of the technology that allows doctors to perform technological wonders in crisis or emergency situations. And TCM isn't backed up by the scientifically stringent studies on which modern Western medicine is based. And yet, many people are disappointed in the dominant medical model and are turning to other therapies, like one of Amy's patients at the student clinic, who came because of severe menstrual cramps and didn't want to keep taking birth control pills to deal with the symptoms.
I'm treating a patient like she has dysmenorrhea for a couple of years. She has to take birth control pills to control it. It's very severe, and she even went to emergency for that. Now she is trying to follow TCM treatment to try to get off this pill because, has a lot of side effects, right? Now she got pretty good result, and for a long time.
Stories about TCM remedies that work where Western medicine has failed are common at this school. But even so, giving up on modern Western medicine wasn't easy. Would you go back to Western medicine even if you could?
I'm not so sure how I would answer that, because now that I'm into acupuncture, I see that Western medicine has its limitations and acupuncture also has its limitations, but I can see that marrying both will actually serve the patient well.
That's interesting.
That's in my opinion. So,
That's interesting. So it's almost as though they need each other.
right.
Would
yeah.
you go back to Western medicine if you had the opportunity to start working at a hospital tomorrow?
Back home I was a cardiologist, I was specialist. I'm really interested with this field. I like to, yeah, I love that, really love that. I would like to work in this field. So we are trying to search other way.
Heading to the parking lot after class, Amy pulls her little suitcase behind her. What's in the bag?
My laptop, my books, my clinical stuff, my needles.
For Amy, the term medicine is much broader than the Western model with which it's become synonymous. Medicine comes from a Latin term meaning to heal or to cure, referring to very ancient systems.
Yeah, so you said your acupuncture needles are in there too?
Yeah, I carry for our clinic.
How many needles do you need when you're a student?
Depends on how many patients we see per day. Sometimes
Full
we see
integration of alternative medicine and modern Western medicine is still far away. But there are signs of change. The Toronto School of TCM is in talks with the province about making student loans available within the next couple of years. And this spring, the government is set to release a report about the new college established 1 year ago to regulate TCM practitioners. But a handful of foreign-trained doctors like Amy and Maria are moving ahead of Ontario's formal healthcare system in order to keep doing what they love best, practicing medicine. For CBC Radio, I'm Mary Weens in Toronto.